Universities and TVET colleges across the country are well on their way to kick-starting the academic year. Now, while the main focus is usually on promoting academic excellence, Higher Health operates at 26 public universities and 50 TVET colleges. Now, the organization seeks to reduce incidences of health conditions such as HIV, STIs, TB, unplanned pregnancy, grievous GBV, and serious mental health issues. Well, let's chat more about this. I'm joined by Higher Health CEO Ramneek Ahluwalia here to tell us about what it is they do. Ramneek, good evening. Thank you so much for your time. So, Higher Health, what is it that you're actually doing at these tertiary institutions to help students who are there?
You know, we are a country where the same post-school education or higher education has universities like WITS, University of Pretoria, UCT, but on the other side we also have campuses in Queenstown, Butterworth, Walter Sisulu, University of Wenda, and similarly most of our TVET colleges are primarily in rural areas or informal settlements in Soweto, Alexandra. So students, primarily more than 85% come from very disadvantaged backgrounds, and the aim is to build this nation or this economy with the next generation of skills labor market. But if we're going to lose them because of diseases like HIV, if 8 million South Africans live with this epidemic, and this epidemic is centered around youth, or 1/3 of our girl students inside post-school education become pregnant and drop out, parallelly the epidemic of GBV, then what are we graduating?
Well, I'm very curious to know what you've been hearing and what you've been experiencing with these students. I mean, we've had campaigns that have gone on for years and years now, and you would think that you wouldn't have to be having, these programs because students should know by now. But tell us what you're finding.
The finding is the unbound freedom, the lack of parental control or guardian control, the peer-to-peer influence, high drugs and alcohol. This is that tender age of 15, 17, 18, when you enter inside the institution or a TVET college, absolutely unaware. And then that peer-to-peer influence gives you that quite vulnerabilities to all these epidemics, Talking about gender-based violence, you're talking about mental diseases, stresses, and substance and alcohol abuse eventually becomes kind of a thing of the young people. So that's kind of research that has shown. Evidence still exists, and so the aim is to get this generation out.
Are they listening to you, though? Are they listening to your people who are on the ground there telling them about these things?
We've seen a change. We've seen a change. Our aim is, the biggest impact is, how can we increase our graduate competencies? How does our labor market say, well, we're getting the graduates that you want? When the parents come and say, well, the hope of our mother is being preserved and given back as an economy back. Our impacts have been shown through throughputs. Our throughputs have increased between where it used to be and where it is. So definitely the wellness issue, the issues about mental health, the gender-based violence, psychosocial issues, as much as the financial support is needed, is the blend of the two together that makes a student graduate well.
And all it takes is one incident for them to leave and never come back.
Absolutely. So if a girl becomes pregnant, drops out and doesn't come back, we lose a child, we lose a student, we lose a hope.
So what support is there for them? I mean, other than groups like yourself or organizations like yourself, what have you found lacking in terms of what the actual higher education department might be providing, or others who should be there in that space helping them get through?
Definitely in partnership with the department. In fact, we are the initiative of the Department of Higher Education Training with all universities and TVETs. We've got presence in all 422 campuses countrywide. The aim is, right from the second curriculum, which is peer-to-peer education, every time at 1 o'clock when the classrooms finishes, those classrooms come to us for extramurals, gender-based violence, mental health, from there to early risk screenings.
And they're coming.
And they're coming.
They're coming.
850,000 young people last year came. And we built a nation with times of early testing of HIV, early screenings of blood pressure, early screenings of, in fact, psychosocial support on the campuses for gender-based violence, for mental health. So the aim is early picking up these infections, early picking up these conditions and trying to get the student back into education. So easy access of services of health and wellness at the doorsteps of the students, so that they don't have to miss exams, no classrooms, and they get this right at the doorsteps.
That's fantastic. And very quickly for us, Ramneek, I mean, how do you get to these institutions? Do they ask for you to come? How do you identify where you go? Are you there all the time? Are you there throughout the year?
So right now in the induction program, the visibility is there. A campaign called First Things First, which runs every month, nothing but a wellness days specifically for students, like we have employee wellness days. Parallelly, the peer-to-peer group, staff are visible inside the campuses. The clinics are purposely built in order to provide those support structures. So the aim is reach out, check out the website, contact the clinic nurse, contact the staff inside the campuses and get help.
That's fantastic. Wonderful work that you're doing. Thank you very much for your time there. That's Higher Health CEO Ramneek Ahluwalia.